You are welcome to CornerStones Klinic channel, an interactive channel dedicated to increasing young people's access to reproductive health information and services. A gynecologist with a passion for young people's reproductive health and well-being is piloting this channel. Today, I will be discussing the topic of menstrual irregularities. Let us consider this scenario. Charlotte is a 19-year-old nursing student whose menstrual cycle has become irregular for 2 years. She menstruated 3 times throughout the last year. She is confused about this challenge. There are several reasons a girl may experience irregular menses. Menses are usually irregular within the first 2 to 3 years after menarche. This observation is a normal pattern in girls who have just started menstruating. There will be no need to worry or take any steps. However, if Charlotte has been menstruating for more than 3 years, she will need to see a gynecologist. It will be necessary to do some investigations to make an appropriate diagnosis and treat accordingly. Let us discuss menstrual irregularities. Menstrual irregularities are common among girls and women. They usually get apprehensive mostly once the menses is not following the routine monthly flow. It could also be that the flow is heavy or scanty, or other concerns. Briefly, let us talk about the common menstrual concerns. Irregular menses. Oligomenorrhea menses may be irregular within the first 2 to 3 years following menarche, but if this persists for more than 3 years after the commencement of menstruation, a doctor should be consulted. Menstruation is said to be regular if the difference in the length of the varying menstrual cycles is not more than 5 days. Once the difference is more than 5 days, it is said to be irregular. Causes of irregular menses are hormonal imbalances like elevated prolactin levels, polycystic ovarian disease, and thyroid disorders. Investigations will be carried out to determine the cause of irregular menses and treat them appropriately. You cannot use the drug prescribed to someone else to treat your menstrual irregularity. There is a need to determine the cause before instituting treatment. Painful menstruation. Dysmenorrhea menstrual pain is very common among adolescents and young people and is mostly innocuous. It should be managed with home remedies like a hot water bottle and analgesics such as paracetamol. If these measures fail, then consult a doctor. However, menstrual pain is severe in a few people. This set of people requires an appropriate diagnosis to institute treatment. Menstrual pain may be secondary to other ailments like fibroids and endometriosis. These diagnoses require appropriate treatment. Heavy menstruation. Menorrhagia menses are said to be heavy when they last longer than 7 days, or there is heavy loss of blood with associated blood clots. A girl can also notice an increase in blood loss and duration of her menses over time. This is an abnormal situation, and a doctor must be consulted. Persistent heavy menses are dangerous because they can lead to anemia, which is a reduced blood level in the body. Common symptoms of anemia include body weakness, dizziness, and fainting attacks. Scanty menses. Hypomenorrhea menses are said to be scanty when they last less than 2 days or appear as drops of blood. This commonly occurs following a voluntary termination of pregnancy through dilatation and curettage, cesarean delivery, manual removal of placenta, infection following childbirth, or fibroid surgery. This is an abnormal situation, and a doctor must also be consulted. Cessation of menses. Amenorrhea can be primary amenorrhea or secondary amenorrhea. Primary amenorrhea occurs when a girl has not yet attained menarche at 14 years in the absence of secondary sexual characteristics, or 16 years in the presence of secondary sexual characteristics. Secondary sexual characteristics are breast development, axillary, and pubic hair development. Secondary amenorrhea occurs in a girl who had attained menarche and the menses ceased for 6 consecutive months. Causes of cessation of menses include hormonal problems like elevated prolactin levels, polycystic ovarian disease, and thyroid disorders. It may also be due to a blockage in the outflow tract of menses. A doctor should be consulted in these situations. It is necessary to mention that the most common cause of cessation of menses in a girl or woman of reproductive age is pregnancy, so the possibility of pregnancy should be entertained. Premenstrual syndrome. In some girls, a constellation of physical and psychological symptoms occurs in the last 1 to 2 weeks of their menstrual cycle. These symptoms include breast tenderness and swelling, bloating, mood swings, inability to sleep, dizziness, tiredness, lack of concentration, etc. It is usually mild but may be severe and interfere with the girl's daily activities. When these symptoms interfere with daily activities, a doctor should be consulted. Thank you for listening to this channel. You may ask questions in the comment section. Kindly like, share, comment, and subscribe to this channel.